Funding?
I wouldn't say lack of funding because since we are taking over the helm of the ministry, we have always been a plea. If we watch the clips from the time we're doing a budget defense, we always have been consistent in the announcing for that particular money to be placed in the Ministry of Health budget.
Is it due to lack of funding?
That's why I say I really can't say the reason is due to. I don't know.
How do we solve the problem if you can say the reason that is due to?
I've always appealed, but whenever the budget comes back, I don't see it reflected that these 9,000, the money has been placed for human resources.
How much have you asked for the volunteer?
Like in 2024, I asked for, I think 10 or 20 million. I can't remember the exact figure, but between 10 and 20, because I believe if we do it in stages, the brand will not be on the poverty. So I wanted for us to do it in stages. Yeah, like this year, we implore, if government places 10 million on the budget, we can implore a certain amount. Then we can now tell the health workers next year, we asking the government to put like 20 million on the budget, then we can absorb everybody.
We know why we're having this conversation. It's good for this kind of interaction. Say we need 10,000 health workers to fill the gap. Every year, government make provision for 1,000 or 2,000. Then the following year, we know we're making provision for additional 2,000. Then the following year, then we know when we end. But every year, volunteer health worker now on payroll. Volunteer health worker now on payroll. Every year, it is on anything that we are not solving. But in my closing, part of your problem has to do with CSA?
Because this is an intergovernmental problem. It has to do with CSA, it has to do with finance, because like currently we have submitted 3,000 plus pen to CSA that has to be processed and taken to finance. So I cannot place blame on CSA to say they are the problem.
Does CSA have to approve? Yes. Or you recruit?
There has to be an improvement, the approval from them.
Okay, so if you say the person is qualified.
They will also do their own due diligence to see whether all the credentials are there. Okay. If you're a nurse, if you don't have your license, then your form will not be and going forward.
Okay. Okay.
Yeah. Whether the issue was due to lack of money, you are hesitating to tell us. Why are you hesitating?
Senator Chi, I'm not really hesitating because I have repeatedly said that we needed funds. But at the end of the day, I do not see the money.
So you've given up?
No, I haven't given up.
You've given up on the job? Yeah. All right, so Momo Saras, but before we go to Momo Saras, I think we should close on this matter. Madam Minister,
yes, sir.
The intent of this hearing is to help.
Yes, thank you.
It's a reform hearing. Everybody knows the story about volunteer health workers. So at the hearing, we intend to have a ceiling, to close on a ceiling. If the health ministry can tell us that we need 9,000 exact to close this gap. Out of the 9,000, we have 1,500 already. We need 8,000 or 7,005. We need to know that today. And this gap that we have to close with the 7,005, here is how much we need. We got to have a budget attached to it. So next budget, if you need 3 million, for example, and we put 1.5 million, we know that we need only another 1.5 million to close the health ministry volunteer workers gap. So any other request that come, will not honor it because we have closed that gap. And will not continue to get the list of volunteer health workers. How many health workers do we need to close the gap? Out of the 9,000, you got 1,000. Do you need the entire 9,000 to close that gap?
Honorable President, yes, but in stages, because the government cannot only absorb or only the money goes to the health sector. There's a lot, it has to be spread around. But I will just also appeal to you to also empower me, because there are some health workers who being placed on the payroll, and they will just leave the counties and come to Monrovia. And when you try to discipline them, you could become a bad person. When you ask them to come back, they will give all kinds of
Workers who are on payroll.
on payroll. They will leave. You
Ensure
employ them.
internal control, internal control, monitoring issue.
They will leave. You employ them. They will leave the counties and come to Morocco. And to trace them, there's so much work to be done. And you will call them, tell the human resources.
But you don't have a decentralized
We do.
structured system and for those people to report.
Senator, the Ministry of Health is one of the most decentralized ministry. If everywhere you go, we have HR, we have a structure that are functional. But the health workers are,
So if we can manage the 10,000 and we add another 10,000, then how can we manage
no,
them?
what I'm saying is that there will be complaints coming. Because I have been here over 3 times as a relates to volunteer. If I block your name, I will ensure that if you don't go to your duty station, we'll drop you off the payroll and put people who wants to be in the county. We have been doing it.
Okay, so to close on our year, what we need from you, we need that report. You talk about a gap analysis report, whatever you have. We need to know the total amount of volunteer health workers that you have, the number you included, the balance, and what we need in stages. Please state it. In 2026, this is what we need. 2027, this is what we need in stages. So you present that to us.
Okay, thank you. I will do that.
All right. Senator Momo Cyrus. No, you're not there.
Thank you, brother. Thank you. Yes, we are all interested in this voluntary welcome, but we think that this was a special hearing regarding the Ebola outbreak. But we have so many questions about these health workers and voluntary workers issued, but we will leave it for another day as per your instruction. After those documents has been presented to us, then we can ask our necessary questions. But today, I heard the interim director of Enfield saying health security is national security. I agree with you. 100% agree with you.
Yes.
But having said that, and I also heard the minister saying that we cannot discriminate travelers. I agree with him. But one question I want to ask: is there any big conference in Liberia that will be over 200 persons that's supposed to be coming from? Is there any pending conference, whether a church conference or something? Have you heard about any conference that will have over 200 persons coming to Liberia?
Honorable Pro Tem, Honorable Senators, like I said, we've had a couple of conferences over the last few. So currently, starting today and tomorrow, we have the Africa Bio Celebrate Lab Conference. It's a scientific conference, especially for laboratory scientists. And the population, the target is about 200 people. Like I said, we have a delegation from Africa CDC in country. And they actually worked with us prior to arrival to send their information. And they made sure that any participant from the affected region will be able to follow online. So they actually worked with us, and we connect the participants that were from the affected countries should follow online.
So let me ask you one very blunt question. You don't think that's a risk to have 200 persons, especially with this situation, to have 200 persons coming to the country? You don't think it's a risk?
No, so the 200 people, most of them are Liberians and are in country. So a small fraction, I would say, maybe less than 10% are international. Most of the participants are Liberian. But what I want us to remember is Ebola doesn't discriminate against nationality, race, creed, or religion. And we are mindful of foreigners, and we have a lot of foreigners in country that live here. So we shouldn't stigmatize those who are in country that have not traveled. But don't forget your fellow Liberians are traveling. And you may be in transit and you may meet a foreigner from a country, affected country. So we shouldn't be narrow-minded that it's only going to come from DRC and only come from Congo. People are traveling and going to other countries and they're meeting people from other countries. So our index of suspicion is high. We want the public to know that we are actively engaging, and as the recommendation, as the risk increases, we're also adjusting our interventions. So for now, we're in medium risk according to WHO because there is no case in the whole of the sub-region in ECOWAS. It's only in the eastern and central part of Africa. So based on that risk is how we stratify our interventions. So for a gathering of that nature, we have worked with the organizers to have screening where they do temperature checks and where they have hand washing stations in place. So we are being more proactive. We are also working with the intergovernmental agents to find out who's having a conference, where is the conference, so that we are more proactive in getting to the guest list, getting to the organizers in preparing. So we're not sitting and waiting. We're not expectant. We are more proactive in going out there because if we cannot close the borders. Closing the border is very dangerous because we have over 100 unofficial border crossings. And what will happen when we close the front door, they will come through the back door, and that will be more dangerous. So we rather people come in where we can screen them and monitor and register. Whereas as opposed to come in while we are focusing on the front door and then it's uncontrolled. So I think that is the recommendation for the
So that brings me to my next question.
Sorry.
How many ground border entries have you covered so far?
So I mentioned 49, but we have port authorities at 8. And of those 8, you have over 51 port authorities, and 46, 42 are not on payroll. They are volunteers. So the challenge exists with getting more port health and getting them on payroll and making sure they are well incentivized and remunerated.
So most of these border entries has got no port officers or even immigration officers. What are you doing? I've heard the research talking about community engagement. What are we doing to get involved with the community, where the community can begin to look out for us where there are no health workers or there are no immigrations? What are we doing? Because the COVID came by land from Sierra Leone and Guinea. That is where most of our foreign borders are. What are we doing in your preparedness? I hear you are prepared, but I don't see you 100% prepared. Like the minister says, 69%. So we still got some loopholes. And until we can elevate our percentage, but get the community for which the borders interests are involved, maybe the township, the citizens to begin to watch out for us strangers who comes through those borders, so they can begin to be our first responders. How well are we doing that?
Thank you very much, Honorable Pro Tem, Honorable Senators. You have noted very well that we are preparing. The minister quoted we are 69% prepared, according to the WHO risk assessment. Coincidentally, the countries that are affected, the 3 countries that are affected, assessment was 64%, and our neighboring country, Sierra Leone, risk assessment is less than 50%. We have scored over 95% when it comes to our surveillance. In terms of us detecting, we are very good at detecting. In terms of us coordinating, in terms of our lab, it drops to like 60, 70%. But when it comes to logistics, what we need now, our supplies. So with regards to the port, the cross-border, we have structures that we are using currently to contain our current outbreaks. We have communities, and we depend on those communities. We have traditional leaders, community leaders, and we have community health workers, health assistants, and volunteers. And that was our strength. That's how we overcame Ebola. It was through the community engagement. So when a stranger comes in the town, and the stranger has strange symptoms, they will alert. And the communities can isolate you. They can put you under house arrest, and they will alert the authorities. So we are working with them, we are engaging them. but we also need to empower them. And by that, we need logistics. They also have bikes, need fuel. They need communication gadgets. How would you call if you don't have a scratch card? So those are some of the limit. That's where our hand is tied. And what brought our score down to 69% is logistics. So we're telling this body that when it comes to men, having a plan, we are prepared. Having the skilled, Liberians have experienced and skilled experts. We are renowned for responding. People come to us to learn. We have our Ebola heroes. We have surge capacity. There are people that have fought Ebola, COVID, that are willing, they understand by they are available. We have partners that are helping us, but what we need from this body is for us to quickly get supplies. The lab has limited supplies, the minister has said. So we need more supplies to be able to fully respond. So it's not fancy equipment that is needed. It's the ability for us to detect that one case and contain it.
Okay.
And that's what
I was here today, sir. You said
I was looking for him. Senator Amar Connor, followed by Senator Topo. Oh, and Pro Tem. Yeah.
Thank you, Madam Pro Tem. Madam Minister and the acting head of the
Senator Duncan, you done?
MPhil.
Oh, I'll jump over you.
Thank you for coming and thank you for the explanation so far. We are worried. We are worried because of history. Today we had a motivational speaker here. He reminded us that we should never forget about the past and we should embrace the present and prepare for the future. Today, Madam Minister, you were in Liberia in 2014 when Ebola came here. Could you please tell this plenary how Ebola entered Liberia in 2014?
Thank you, Honorable Senator. And the speaker that came, he did very well to remind us, because some of us, we have forgotten. We tend to politicize everything. So they passed through the Guinea border and they went to Lofa. The name of the town, I spoke with the president, he kept on asking me about the town. And have you been to the town? So I think it's Lungabar or something like that. And I went to the town quite recently, I was in Lofa. And those people are prepared. The citizens there, the lessons that they are even teaching we who the health workers cannot be even found in the textbooks. That's how it came. Just a single case escalated until we have 4,800 deaths.
Thank you, Madam Minister. You're quite correct. Now, to the present, Ebola has been reported in Eastern Africa, specifically Uganda, and then DRC, which is Central Africa. We have Kenya Airways. It's a major airline that with regular flights, I think weekly or so, into RIA, coming from that region. Do you have any surveillance presence at our international airport?
Thank you, Honorable Senator. Can the interim DG can comment on that?
Yes.
Thank you for that question. As a recap, we do have surveillance, we do have interventions at our port of entries, including our land, sea, and air, at the Roberts International Airport, in collaboration with the Airport Authority and the Liberia Civil Agency. We have had preparedness meeting, we have coordinated, we have done an assessment to assess our arrival, also a proposed holding area, and basically the gaps. So as we speak, we have installed digital thermal scans that are able to take temperatures as passengers, as travelers pass through the arrivals. We also
Is it active? Is it active now?
Yes, it is. It was the installation completed yesterday. We have 3. The second one is going to be installed. Yeah, and then there's a third one that needs to be repaired. So we also have mounted sanitizers along the arrival when you enter. We have mounted sanitizers, and we have our port health. There's a health declaration form that we worked with the airlines to distribute prior to arrival. And we're currently working with the software developer that developed the app, the digital app during the COVID. So they already have the technology, it's just about updating it for us to be able to use that. So travelers can fill in the information prior. With regards to the land, we have also sensitized our health workers, our port health. We have sent supplies. The digital scanner that we have requires electricity, it requires shelter. So our land borders will be deploying more of the handheld thermal flash. And we're working also with our counterparts in the neighboring countries. So we have only 8 official borders. So like I said, the community engagement is important. The cross-border coordination is also important. I don't know if I answered all your questions.
Yeah, thank you for that. Because my next question was going to be the land borders, where you said you have about, 8, including air, official one?
Yeah, those questions were answered already.
Okay. My next question would be the hospitals that are closest to the land borders. How prepared are they in terms of responding in the likelihood there is a case close to the border, so they don't come like Ebola patient number 1 that came here and went to chicken soup factory, slum community, and created havoc for the country?
Honorable Pro Tem, Honorable Senators, our hospitals, our facilities are prepared. I say this with confidence because Liberia is constantly being tested. Our system is constantly being tested by our ongoing national outbreaks. We are Lassa endemic. Lassa fever is a viral hemorrhagic fever. It presents with malaria-like symptoms and it causes bleeding. It's a small brother to Ebola. So we have been managing Lassa, and currently we only have 1 case. And basically the same measures, the same way you detect, and the same way we control Lassa. So we have been practicing, we're constantly preparing for viral hemorrhagic fevers, be it Ebola, be it Marburg fever, because in Liberia we have Lassa. So the hospitals have protocols. They have case definitions. They know when to suspect a possible Ebola case. They know who to call. We have surveillance officers in facilities. We have 4455, our hotline. We also have the county. So the county has a structure that is existing and that is functioning. So what we need now, because Ebola is devastating and it spreads very fast, we need more support to strengthen our system. So we have the plan, we have the protocols, we have the expertise, but we need the supplies. That is where we're appealing to this August body to help us with.
Thank you. And I have a follow-up question to the request for supply. Have you communicated that to the president and the cabinet? And do you have the numbers? Because, the president and the cabinet will have to approve and then send it over to us. Have you developed something and share with them?
Honorable Pro Tem and Honorable Senators, we have developed an Ebola emergency preparedness plan. And we have an exhaustive budget.
How much?
I'm not a member of the cabinet.
No. This is Ebola is we call you here. I'm coming. We appreciate the institutional assurances, but I think the reason why the Pro Tem and all of us call you here is to be able to have accountability, verification of everything you're telling us. Mm-hmm. Even to the point where, as a member of the health committee, I'll be proposing to my chairman and colleagues that we visit the airport. We see some of this stuff. just to make sure that we are ready. Don't be scared.
So the ministry will have to publicly give us that budget amount before they leave from here today.
Thank you.
Yeah.
So,
There is a public hearing, and we need to get all the information publicly.
so in the health sector, we have chain of command, and that is why even in our surveillance, so the Minister of Health spoke prior to
Madam, the Pro Tem has spoken, and that is the decision of the plenary. If you want us to support you so that you are ready to fight Ebola should it come to our shore, then you will provide that information, because this is where appropriation decisions are made.
Yes. Yeah, follow up on, hear from the chair.
Okay, so thank you very much. I just wanted to comment on the issue of the budget. We know budget is not cash money sitting somewhere to be used. It is a plan. So once you develop the plan, the activities inform the budget. And I believe some of my colleagues must have been here during the 2014 Ebola issue. I followed it. I was in the Senate, but I was in government. The first time we heard about Ebola was from the late Dr. Bonnie Hale, who was minister.
Yes.
And I remember
the proposal to this body or at the HOR thing. It was $1 million. And it went wild in this country with different perception, different statements against that money. Like the minister rightly said earlier, that people said they were ready to eat money. At the end of the day, millions of dollars went into the fight against Ebola. I say this to say, do not be afraid to state the amount. We all here know that in order to deploy people, it will cost money. Whatever plan you have, let us know. We will work. We are not saying that we have the money or we have that amount. But your plan and the activities that inform the budget will be discussed. And then we'll come to what is realistic and what can be made available to prepare you. Thank you.
So,
I think
they have to tell us the budget, and the best thing we can do is to not hold back when it comes to Ebola. We all were here, we experienced it. In fact, I got 2 awards, international awards for taking care of social mobilization, and 1 local award through my foundation. So I know what it means, and we know how we work. We approve the money, but if we ask Pro Tem Emeritus, I champion the Ebola audit. Every day I was asking for Ebola audit for that money until the audit was done. So giving us the budget doesn't mean that you're not credible. There are stages and you need to start working now. And I don't care how much health workers you put out there. I don't care how much money you have in the budget. The best people to handle the Ebola social mobilization aspect are the people in the communities, in the villages. So the education has to start now. Yeah, because they will do the work.
And it costs money. It requires money.
Yeah, so the awareness needs to start.
Yeah. I'm on the floor to one last one, then I will yield.
Yes, you should follow the medium, the channel. Yeah.
Still got the floor. You want to do observation? But put them with
But I was recording, they need to lock my door and put all my workers, and also I was looking for all the old masks that were under my pay and the bucket and to wash my hands. So it created. All right, so Senator Topo, we are coming to you next, but I think the minister is ready to give us the budget.
Thank you, Pro Tem, and thank you, Honorable Senators, for the support we have received. I just want to, before we came, we did an analysis of what was spent during the 2014 to 2016. And approximately, I'm around here, but we did some research, and I think we're almost like billion. I think about 5 billion in the 3 countries. And if you do the proportion, because we had the highest debt, so I would assume that we got like 2.5 billion, but we are not asking for that amount. Because if we had Dr. Gordon Gali, peace be to his ashes, said 1 million. If we had given Dr. Gordon Gali 20 million to save one person instead of politicizing and not having trust in the health sector, the devastation would have been prevented. So we did our budget based upon pillars. In the IMS, as it relates to surveillance and response, there are 11 preparedness budget, there are 11 pillars. So you don't just do the budget, you got to look at the various pillars. We have risk communication and community engagement. I heard one of the senators talking about community engagement. So on the budget for community engagement and risk, we have 149,000, just a little over 149,000. Surveillance that needs to be beefed up. We have for surveillance, we have 376,000. We have cross borders, the POEs, because we have renovations of those structures. Like I was in one of the counties, I was in Bond County, and I went to do the assessment of the POE, where in case we have a patient, where do we place that patient? We need some renovation done there. And it goes across the 15 counties. So for the POEs, we have 335,000, a little over that. Infection prevention control. You need PPEs, you need a sprayer, you need a goggles, you need a boost. We have over 900 now. Case management, just in case, because we do not have any case now. But just in case we have a case, we only estimated as 34,000 because this is preparedness budget, not response. It's 34,000. Supplies and logistics. We need fluid. As I said earlier, that this particular disease, if you treat them with fluid, you give them sufficient fluid, we learn that 50% of the cases recover. So what we intend to do, we intend to establish our own fluid place, production. We want to produce IV fluids. We have the technocrats here, and Dr. Peters is one of those, and we want to produce our own hand sanitizer. Just in case it becomes so hard, nobody bringing fluids in the country, nobody bringing hand sanitizer, we have our own production in country that we can use. And that's about 500, a little over 500,000. And we have the sanitation, like the environmental health and health pillow, about 300 and some thousand. Because in the federal hospital, you need running water, you need, and all the environmental stuff has to be there. So then we have human resources, like the.
So what is the total preparedness budget?
So I was just saying. So we have
that's the preparedness
budget is 4.2 million. That's the total preparedness.
All right. The total preparedness budget is 4.2 million.
Just for preparedness. That's not a response budget.
Yeah, but we need to start working with that. All right.
Closer, I just want to close.
All right. So
thank you.
You've done Senator Conlon. We got 3 more persons. We'll hear from Protein Meritus, then Senator Topo, and Senator Duncan last.
Thank you, Madam Minister. Thank you for that.
Yes, so man.
But then the chair will close, and then after the chair will collect all of the information we asked for and do the distribution. We'll go over them, and then we'll have another conversation with the minister and her team before the end of the week.
So my first thing will be a comment on stigmatization the minister spoke about. Because I see people hearing, asking questions. How many people come from conference? How many people come from Uganda? The Ebola attacked us here, and all the countries opening their arms to us. Even I remember quite well for the United States, in fact, they were telling Obama that don't allow Liberians to come. He said no. We gotta go to the source and attack the source. We shouldn't close the country. So I appeal to all Liberians that we shouldn't stigmatize and say, oh, the person just come from traveling Uganda, and no, be careful, no. Let's be prepared and deal with it. Minister, for vaccine, for COVID, we have vaccine later on. What about Ebola? What's the process? What is the status of vaccine?
So for this strain, there is no approved vaccine. I just learned a few days ago that Oxford University, they are producing a vaccine that hasn't yet been tested. So, the outbreak just talk about 1.5 months. Apparently, from what we've been seeing, it could be longer than that, given the scale of the cases that we have seen around. But there has to be a quick clinical trial. So for you to approve the vaccine, the timing is too short for a clinical trial. So they are in a preparatory stages for this vaccine. I'm sure there will be a clinical trial, then approved vaccine. Even therapeutics, so you just treat signs and symptoms.
So, internationally, the need for vaccine, because people are saying in the public that COVID affected even the West, everybody. And Ebola seems to be localized to Africa, and so the scientific institutions are not pushing for vaccine. How can you clarify that?
I believe that I disagree respectively with those views. We are getting a lot of support from our international partners.
So as part of the response, in communities we have small clinics, and those clinics are part of the first response. People go to symptoms and so. How are the clinics prepared? The small clinics, private and public, the small ones.
So because the primary healthcare facilities, that's why you saw the budget being read. They will need the PPEs, they will need a hand sanitizer, even the buckets. Everything we will need to be able to work before they transfer to the next level. The good thing is that I usually say that God is wonderful, very wonderful. We put in last year for 25 ambulances. And it was so delayed because of the procurement processes, and I was getting so frustrated. But surprisingly, this week, the 25 ambulances came, and they are now at the Ministry of Health, and this is going to help us with our response processes.
My last more question. We know for part of the preparedness, good hygiene, good sanitation, and washing. It is said that to fight Ebola also we have built an immune system. Is that information accurate? And what can we do to build our immune system while we are washing our hands?
So the immune system, you have to eat healthy. Eat healthy. Yeah. Exercise, rest. If you're drinking beer, you put alcohol down a little bit.
What are you referring to?
Vegetables have more vegetables as compared to carbohydrates.
The people in Brandon kind of eat vegetables. Please,
potato greens.
You got? Sarah Topo and talking
Yeah, Madam Protein, distinguished senators, I just have a few questions. One, I would like to ask the NFIL interim DG, as they call it. Do you have, in terms of infectious diseases, in terms of preparing for outbreak, do you have a standard training protocol? Do you have a standard training protocol?
Honorable Senator, yes, we do have standard training protocols. As I said, we have trained over 200 field epidemiologists frontline, and they have been deployed. That's why all our health districts have surveillance officers, and we are currently upgrading these protocols. As you're aware, the new strain of Ebola virus is the Bundubujo virus. There are 4 types of Ebola viruses that affect humans. 2 only affect animals. So the 4 being the Zaire, the Sudan, the Bujumbura, and the Tai. We have more experience with the Zaire. That was the one that was responsible for the outbreak in 2014. So we are adjusting our protocols. As the minister rightly said, there are no vaccines proven to be effective against this current strain, and there are no medication therapeutics. So we have to do what we call supportive care in that we manage the symptoms. A lot of the people that... Okay, thank you.
I want to know the second part. Did you move or are you aware of a training at GFK? Protocol.
Okay, so yes, GFK is an autonomous institution, and each health facility, we have continuous professional development. We have in-service training. So even without an outbreak, our people need to be abreast and current with the current management of infection prevention and control. So you do training so that your team can be prepared for any eventuality. So as we're in alert mode, all health facilities have been informed and everyone is preparing their team. So in those preparations, you will have simulations, you have scenarios, you have examples, and they're asked to respond so for example, if there was, what would you do? So those scenarios are used to train and to identify knowledge gap and also identify where there are gaps. So if we don't have equipment or supplies, you will learn through training. So training is part of normal medical continual development.
In the training, example would be, you don't have to say if, you can say, on this day, example question. Mm-hmm. On this day, 25% came from this country. 6 of them were this, giving this sound, blah, 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 blah. How do you respond? Is that something we can ask a question?
It's possible. You give a scenario. Even as the Public Health Institute of Liberia, there will be simulations. We will simulate a case so that we can test our system. Myself and the minister will not even know when that will happen. Yeah.
I'm asking the question because we are in a country where sometimes people think they know how to teach. There are different ways to give case study. They want to give example, and that could be one of those. Because the way the information came out, the possibility that the case study was based on us. So that's why I asked the question, just to the public here for you. But this is my real question, and to the Minister of Health. Thank you, Madam. That one our case study.
Yeah, we had a last question.
That one was case study.
We had a last question.
That was a case study. See, not a real question. Yeah, I wanted hypothetical issues there. Because there's no Ebola going to them, so they were doing scenario. So, Madam Minister, Comrade, I got a microphone. Please be careful.
Sarah Koga,
be careful. I got this microphone. Be careful, please. Okay. Madam Minister.
The board has only one question. We have to go.
Madam Minister, the volunteer.
Yeah, on the list.
Madam Minister, Protect, you straight in to ask one question. But you didn't say I can't make a comment. You asked one question. I can make a comment. Madam Minister, the list that you have as pending and those have already been employed that were for the volunteer, did you obtain it from the county health officers?
Yes, sir.
You obtained that from them. Yes. Are you very clear as a minister because you're not all on the field? I'm asking the question.
Yes, we did because I must.
Madam Minister, you honor oath. I'll ask you a question. Are you clear?
I must commend the county health teams. The county health officers are the ones that submitted all those names. They are the ones.
So, do you believe that what they send you are the people that are in the country working, volunteering?
I believe because they are the ones that represent us in the various countries.
I have reason for asking my question, Senator Barney. I got reason. Are you cheering? Yes, that's what I'm going for you. No, I won't be focused to the minister.
Yeah, that's very important.
Yeah. Do you believe that what they gave you
I believe
Are the people in our county volunteering?
I believe him.
Okay, so let me give you a case. I did an analysis of your list, and I found that of the 40-some roles that you employ as volunteers from River County, only 14 are currently in River County. So please check that.
Thank you very much. So that these are some of the things that we're looking at. So brethren, yes. So we're dropping, yeah, and they will come to you
Go.
and say, Dr. Kpoto, targeting me.
Then the reason I said so because in March of this year, I decided to thank the volunteer nurses by giving them rights to tell them thank you. So I got a list that was given to my office of which they came to collect the rights. So all those that collected the rights that was there working, I didn't see them, most of them on your list. That's why I asked you the question. So I think it may apply to other counties.
So that's why it's important to get a list per county.
Yeah, so we have now the analysis. So please, let's go back and be very clear because we don't want people in Monrovia and pretending to be in our county. And every time we got 129 plus volunteers, health workers in River County that we're seeing there, but we check in the list, we see a limited amount. That's my concern. Thank you very much.
So currently notice that we are having a lot of attrition once they get employment, then they come back to Monrovia and they don't want to go to the rural counties. So we ask CSA to go and do verification for us. We ask a partner, we got some funds, and we give it to CSA. And the first place they went is the Southeast. We are waiting for the CSA boss to be able to give us that report because I was telling my team we don't want to go to the rural counties. It will be like we, the Ministry of Health, witch hunting health workers. So let the CSA go and do the verification and give us a report, and we can act upon the report. So the dates go to River G, so that report will be given to us.
Just do your work. Don't worry about what the people say. You have to do your work. Yeah, you have to do your work.
So another thing, an honorable program that we spoke about, my team and myself, the decentralization of the budget. I believe the budget should go to the human resource budget should go to the county. If it is controlled by the counties, it's better. So the hospitals, like how if CB Doma Hospital controls a CB Doma Hospital controls their payroll. If you will shield people who are not going to work, it's up to you. If the new Simple that we're about to work on, they got to help workers. And they're telling us that they have 200 persons on the payroll. If that budget goes to them and they shield that health worker, it's up to them. They will not have the workforce on the workflow. So that's why we're advocating for decentralization of the payroll. The Ministry of Health will just supervise those payrolls in the rural counties along with the county health team and the local government to ensure that these people are, because some people are using the health sector as a conduit
So decentralization, and then you publicize
the
payroll, and then everybody here, including people in the county, can help with oversight.
We did a communication to the CSA boss asking for decentralization. Like how you have here, Debbie got their own payroll now. You have Phoebe, you have all the other hospitals with their own payroll. Let other government hospital and Jeffrey has its own payroll. Let other government hospitals get their own payroll, and the county health team and CFD people will not go. Yes, it cannot just be at the central ministry. It becomes a little difficult. Yes, very complicated.
So that's an assignment. You need to work along with the ministry on that. So that's what the reform hearing is about, to get this information that will make it easier. Senator Taba, the chairman will close. No, don't get when I tell you. The Senator Taba Fabla will close. After Senator Flay is late. After our closing statement, we'll sing the birthday song for Taba and Yan Fire, and we'll proceed to Sunday week. So, Madam Chair, please.
Thank you, Pro Tem, and thank you, Coach, for the level of interest that you have exhibited in the health of our people. I know that this hearing, we started it with a purpose, and I believe we are nearing close to achieving that purpose. And thank you to
team from both Enfield and the Ministry of Health for the information that you have given us today and given to the nation. Because as we all are aware, everyone is concerned, especially about the Ebola outbreak. Whenever Liberians hear about Ebola, we are reminded about a very bitter past. So, but it's good that today even the population is more anxious and more informed about what Ebola can do. That is the first step of preparedness. And I'm glad that you people reported that you have a full preparedness plan, at least for the next 3 months, while you prepare for the response if there is an eventuality. We pray that it doesn't reach here, and we are sure that some of the efforts that you already have in place, like at the airport, is really commendable. And I will encourage the team, especially the health team, to visit the airport to assess the level. I know I passed through there on the 17th, and the people were already sorting out people that were coming from that region, which really told me that indeed the health sector is ready. Having said that, this hearing will mainly focus on volunteer health workers. And as I listened to the infield and even the minister, the surveillance at the borders, most of the surveillance officers are also volunteers. And that is a key issue that we need to look at. There was a question about whether it is the lack of funding that got some of the payers stopped at CSA that were not really answered very clearly. But my question here is, why we look at the thousands of volunteers and we have this emergency at hand in terms of preparing for this Ebola outbreak in the east and central? Can we focus our attention and work with the CSA to see how they can try to expedite, especially surveillance officers that have been, because that's the only way they'll be motivated to work extra hard at this time to avoid an outbreak in this country. Can we focus on that to handle it as an emergency, as part of our emergency response? Thank you very much. Thank you, Protein, for the opportunity.
In furtherance of this, we'll ask the Ways, Means, and Finance Committee to also bring in the Finance Ministry. Let's engage them about this preparedness budget.
So, just to respond to the chair constraint, there was a $3.5 million in the supplemental for closing the gap at the Ministry of Health in terms of the volunteers, and another 1.7 for placement. So the two appropriations we made.
So we can use that for the Ebola?
No. I mean, I was responding to the gap. So I will also bring the funders and health together to see how we can begin to source funding.
All right,
for the preparedness aspect.
We can do that on Thursday.
Yeah, Thursday.
We need to close this.
Okay, Secretary of Senate, please take note and write funders and.
All right, before the motion, happy birthday to you.
Happy birthday to you. Happy birthday to you, dear. Happy birthday to you. God bless you. May God bless you. May God bless you, dear. Happy birthday to you. That's no fun down there.